Hey, sir. Tagging off of what Mr. Pallone said. Now, in your testimony, you say that for every $1 spent, the program saves $790. And it begs the question that if you have to take a 2% across-the-board cut, why are they going to cut the programs that would save you $7.90 per dollar spent? Is the management so inconsiderate of return on investment that they are going to save something which saves $7, that they're going to cut something that saves $7.90 per dollar spent? That's the testimony you suggested.
Dr. Cassidy, thank you for that question. As you know, the specific cuts related to the sequester have not occurred yet. There's been a lot of internal planning and preparation for the way to do any cuts if they should take effect.
But I have limited time, so if the taxpayer's listening and the taxpayer's wondering what kind of management would cut a program which has an ROI of $7.90 per dollar spent, and that's your testimony, what was management thinking that this would even be on the table?
Well, what I would say, sir, is that the thinking is that what our number one priority is making sure that beneficiaries get the medical care that they need. And if we have
But clearly, if Mr. Pallone is right, that the money you save goes back into the trust fund in order to support that medical care, I think the taxpayer has every right to wonder what in the heck she's spending money for. If we are cutting something with an ROI of $7.90 per dollar spent, do you see my concern?
I do see your concern. I also know that in the immediate short term, we have to worry about our principal mission, which is making sure that beneficiaries get.
So there's nothing else that can be cut between actually paying for medical services and something which gives you an ROI of $7.90 per dollar.
There are very few things that have been exempted under the terms of the.
I will tell you, it calls into question the wisdom of your management. Secondly, you make a sense, you create the impression that if we cut under the sequester all these valuable things, but then what Dr. Burgess just brought up, which I'm sure is because of his staff's good homework, not his own, that only one out of 7 of these things demanded by the Affordable Care Act, which passed in 2010, has been fully implemented. It doesn't seem like a sequester cut now is going to be that which is fatal to their implementation. It actually seems as if there's kind of a casual timeline anyway.
Sir, I'd point out that there are a few more pages of provisions that actually have been implemented.
But I'm speaking specifically about waste, fraud, and abuse.
That's exactly what I'm talking about. We have implemented many provisions in the Affordable Care Act that have greatly strengthened our ability to fight waste, fraud, and abuse. And in doing so, we always have to establish our priorities and allocate our resources appropriately.
Okay. Well, if we're going to establish priorities, then I would suggest that the taxpayer would like that you continue to spend money which gives you a $7.90 return on investment per dollar spent. Now let me move on.
Sure.
And I don't mean to grill, but this is obviously the process. We're all familiar with the New Yorker article about McAllen, Texas, how in CMS is under Medicare, the hospital in McAllen spent 180% of a cohort spent, of the amount spent on a cohort in El Paso. There's a follow-up article on that in Health Affairs in which Blue Cross Blue Shield patients, Texas Blue Cross Blue Shield, 7% less was spent for the cohort in McAllen than in El Paso. Under CMS, it's 180% more. On Blue Cross Blue Shield, it's 7% less. It seems like the problem may not be the docs, the patients, or the hospital, but it may be CMS's systems. Just looking at the contrast between the two payers and the results they get. What comment would you have on that?
I'd say that one of the advantages of our having established the strike forces under the joint Department of Justice and Health and Human Services aegis has been to look at the highest fraud areas very carefully.
But why did Blue Cross Blue Shield figure this out prospectively and we're having to do strike forces to get it retrospectively?
The populations that are being served, sir, are very different. The situations are very different.
64 years old and 65 years old, these are the same patients in the same hospitals with the same doctors. Again, this seems somewhat of an indictment upon the system because there's not that much difference, I'm a doc, between someone 64 and 65.
I don't have a specific answer for you on that in that area. I'd be happy to look, for anything more specific. But I will say that we are focusing on the high fraud areas, and we are making major progress in identifying discrepancies like that and working together with law enforcement and with the private sector to do something about it.
Thank you for your testimony. I yield back.